know, we're recording this. My name is Brett Rosenberg. I am the new and grateful chair of the City Club Board of Directors, and I am delighted to see so many of you here with us today. City Club's mission is to bring people together to inform and inspire them on issues vital to the community through public forums that encourage the discussion of new ideas and the free exchange of thought. We have a deep commitment to civility and civil discourse, even when we often discuss very controversial issues. Before I introduce our moderator, some thanks are in order. As always, thanks to the University of Montana, and in particular, Alex Karklins for keeping the Zoom train going on time and making these virtual forums possible. Also, thanks so much to the Missoula Community Access Television, which records our forums as part of their media assistance grants to nonprofit organizations. MCAT serves our community on cable channels 189 and 190. You can also find videos of past CCM forums by clicking on the video button on our website, cityclubmissoula.com. Thanks also to our sponsors, particularly our executive level sponsors. In addition to the University of Montana, those include Blackfoot Communications and First Security Bank. We also like to highlight some of our other sponsors every month. So today I want to recognize Missoula Broadcasting Company, MMW Architects, and Montana Public Radio. We're grateful to all of our very diverse sponsors, and we invite you to join them by going to our website. And of course, thanks to our board of directors and our administrator, Eric Legvold. Now, let's get going here. According to the Missoula Public Health Department, approximately 1 year since COVID-19 entered the United States, there are 198 current cases in Missoula County, 7,808 cumulative cases, and 7,528 recoveries, and sadly, there have been 82 deaths. Never mind the effects on schools, businesses, and our overall sanity. Today, we have with us a panel of community leaders who will address this past year and offer some insights into what the future may hold in Missoula. Here to introduce our panelist is Maritza Giorgio. Maritza is an evening anchor at NBC Montana. She lives in Missoula with her husband and son and is a proud product of the University of Montana School of Journalism. For the past year, she has been working from home, much like the rest of us, to provide answers for Montanans about the COVID-19 pandemic and its impacts on the Treasure State. As soon as I disappear myself, Maritza will introduce today's panelists for COVID-19 1 year later. At about 12:15 or so, we'll begin our question and answer session. So now I will turn it over to you, Maritza.
All right, thank you so much, Brett. And I'm going to introduce our panelists here. A lot of knowledge with us today. Joyce Dombrowski has been with Providence St. Patrick Hospital since April of 1995, and she joined the team earlier in her career and had responsibilities for critical care, emergency services, and quality. Now, her current position is the Chief Executive for the Montana Service Area, which includes St. Patrick Hospital in Missoula, Providence St. Joseph Medical Center in Polson, and Providence Medical Group, overseeing approximately 2,500 employees and providers. She holds a Bachelor of Science in Nursing from Montana State University in Bozeman and a Master's in Healthcare Administration from the University of Minnesota in Minneapolis. And Joyce is a native Montanan and lives with her husband in Missoula. Grant Kerr has served as president and CEO of the Missoula Economic Partnership since 2018. Prior to that, he served as treasurer of the board of directors of MEP, while leading Five Valleys Land Trust as its executive director. MEP was founded in 2010 in response to the Great Recession and is focused on expanding high-paying jobs across the country. MEP leads Missoula County's COVID Economic Recovery Task Force, which assesses the impacts of COVID on our economy and coordinates response and relief efforts among many public and private partners. And Paula Short is Associate Vice President in Marketing and Communications at the University of Montana, and since the start of the pandemic has led coordination of the university's COVID-19 response. She is a alumna and received her master's in organizational leadership from Gonzaga University. So thank you, panelists, welcome. When we were discussing the flow of today's events and the topics we were going to cover, there certainly was no shortage, as it seems COVID-19 has impacted every single part of our lives, even down to how we buy toilet paper. So I want to start with a theme that really covers all areas, and that is how much COVID has exacerbated inequities and also strengths and weaknesses in our systems. So who wants to start?
I can start. I don't know that I have the direct answer to the inequity question, but I just wanted to first thank you for this opportunity and also Thanks to all of the frontline healthcare workers who have so valiantly worked in our community and certainly the surrounding state for their year of tremendous service. I would say from the Providence standpoint, the inequities have really not been forefront, because what we've been really focused on is trying to create or build that plane while we're flying it. We did that a year ago when we were asked to be ready for a pandemic. And as we move into this part of this year, of course, we're focusing on vaccines. And vaccines are critical. We feel very grateful to live in a community where there is a huge desire to receive a vaccine, but there also are limited access for vaccines. I'm not probably telling anyone anything they don't know. And I want to assure you that our relationship with the City County Health Department, with all other health providers in the community, as well as with the State Health Department, is strong. We are in conversation with them daily as to how much vaccine will be allocated and then how we will appropriately use that vaccine. We're really through the 1A portion of the vaccine, which are the frontline and essential workers, and moving into the 1B. And we're really focusing on getting that vaccine to the higher risk individuals in the 1B category. And so I think that's where we're focused on, if you will, inequities, is that we're risking individuals who should have the vaccine ahead of others within the 1B category. It's going to take us some time. We're confident we're doing it well. We're confident we're communicating as effectively as we can. And one more time, I really want to put a plug in for the work that's being done with our City County Health Department. And certainly our EOC. We couldn't do it without each other. And we're doing it, I think, in a way that this community should feel proud of.
I'll jump in next. Just, of course, here at the University of Montana, we are focused on providing an education that is accessible. And that is one area I think that has been really brought to the forefront with this pandemic. And that is, how students are able to access their education. And that's everything from certain learning modalities and how to configure classrooms, particularly those in-person classrooms. How do you reliably physically distance those and have masks to keep transmission in classrooms low? At the same time, for those classes that are remote, are they synchronous or asynchronous? And how do students access the technology that's needed to take a Zoom class online, for example? And I think for whether you come at COVID-19 from a education standpoint or really any number of perspectives in the community, whether it's housing or healthcare, I think the big challenge is that everyone experiences this pandemic a little bit differently. And so because everybody's challenges are somewhat unique, it's very difficult to develop a standard solution. So it requires a lot of innovation and creativity. And I do want to underscore, I think one of the things that Missoula really has going for it is the level of collaboration and innovation. And those things aren't rapidly stood up in response to a pandemic. They are the fruits of years of relationship building. And I think that's something that we can all be proud of, is our ability to come together and problem solve with that in mind.
While we don't have a lot of involvement with vaccinations, I think I could comment a little bit on some of how the inequities played out in terms of our communities and sort of exacerbated strengths and weaknesses, and maybe speculate a little bit, I guess, on what we think vaccines will do to some of the economic recovery. Some examples of where we saw our strengths and weaknesses exacerbated around some of the inequities we see in our communities. A great example would be rural broadband access. We saw this early on with schools and the ability of rural communities to deliver content to their students online. We saw this in the middle of the pandemic when some of our rural schools did have COVID cases, and kids who were participating in school had to go home and they didn't have access to fast broadband speeds that allowed them to continue doing learning online. Another example, I think often we see business owners, people who are outside of the business world, see business owners as a class of people who tend to be more influential and powerful in our communities. I think that's a kind of a misnomer, and there's a real difference between our bigger companies and small local businesses. And what we saw early on in economic relief was that the CARES Act had this paycheck protection program, and it was delivered through our banks. And small businesses that didn't have a traditional lending relationship struggled to figure out how to tap into those programs because they didn't have big bank relationships or ongoing loans. So it took a while for us to develop the tools and the teams, and we did this in partnership with the University of Montana through their BEAR program to figure out how to help small business owners understand how to access some of the relief programs. So it really did create sort of a race to that early relief package. And that had a lot of consequences downstream for who got relief when and how fast they were able to sort of get back up to speed before the summertime when we saw more people operating consistently and regularly. Then I would say in terms of sort of vaccinations, I think I know that what we will see, I'll give you one more example on the relief side. The Missoula County did a great job of standing up this really quick relief program through some of their community development block grant funds, just at the end of the year when we knew there was a gap between federal aid and the upcoming sort of package that we expected to come out after the presidential election, whoever was in office. And even that program, there seemed to be a challenge for a lot of rural businesses to tap into that because it was really an online application process and it was first come, first serve. So again, that speed and access to broadband. So I think one of the things that we need to be mindful of in the vaccination process is just using every channel imaginable to get information about how to access those vaccines so that people aren't dependent on broadband. And there's no question that all of the evidence in the world showed that it was not the shutdowns that really caused economic downturns. It was the fear of cases. And so in early days when people were afraid of the unknown of the COVID cases, they stayed home and they didn't go out and engage themselves in the economy. Later, when we saw the spike in cases in early October, the same thing happened again, where people withdrew from their practices and didn't go out and do business. So for us, it's essential to get those vaccines out as quickly as possible, as broadly as possible, and equitably as possible, so that people do have the confidence that they are safe and they're able to get back to business as usual.
So to continue on that vaccine topic, I know getting, like you said, Grant, getting the information out across all platforms, a conversation we're continually having, but people are really hungry for more information on this process. So I want to go back to Joyce on, more details about where we stand in Missoula right now. And I know you started to touch on this, Joyce, but what are you hearing about timelines on vaccines and anything else the public really is desperate to know right now?
Certainly, I really appreciate the desperation for accurate information. And what I will tell you today, Monday, February 8th, may actually be different tomorrow, which is inherent in this entire pandemic. But I can't emphasize enough, first of all, the state DPHHS, so Department of Health and Human Services, has a wonderful website that they do update every day. That's where most of the information from, I believe, the media comes from, the number of deaths, the number of cases in the county. They have also been updating it with the number of vaccinations. That is from data that we are submitting. So we are transparently putting that data back on a regular basis so that we want to build confidence in everyone that the vaccines that are coming into Montana, in fact, are getting distributed as quickly as possible. Number one. Number two, that the vaccines that are distributed each week is unpredictable. And unfortunately, then that creates instability in our ability to plan. And that's not just for Missoula County, that's for the entire state. So where do you get information? I would say that website is the best. The other place where you can get information is on like a Providence website, or I'm sure Community Medical Center has one. The county has a website. I get that all of those are website internet based. We have a lot of individuals who either don't have access, as Grant said, or are not comfortable using it. The challenge for us is if we encourage our patients to call their primary care physician, which might be a natural request, our primary care physicians are not in the best position to have the most real-time information. So we continue to go back to the websites and are really hopeful that wherever an individual can access a website, they would, because that's the most up-to-date, accurate information. We would never tell a patient not to call their physician, but it has gotten frustrated. Our own patients have felt that our physicians don't have the information that they need. For Providence patients in particular, and I know this is the same for community, if you can access, again, some information through your electronic health record, but I'm being repetitive. Again, we're asking you to go out to the internet to get that information. We'll never not answer the phone. We'll give you the best information we can at the time. And really the bottom line is the vaccine supply remains unpredictable. And until we get that predictability, we're really going almost day by day. The last thing I would say is if the vaccines can get distributed to pharmacies, I was on a call last week with Governor Gianforte, and he assured us that that was his next priority for distribution. We know that that will be very helpful. Individuals are comfortable going to pharmacies, seeing their pharmacist, and they have a wide distribution in the state of Montana. So we're hoping that that will get announced and actually might happen by the end of the week.
And now's a great time to reach out to anyone in your life who may have an internet barrier and try to help them navigate that process.
Absolutely.
Paula, I want to go to you because the university seems to be ramping up to play a larger role here. Tell us where you're at and where you see it going as we get closer to widespread vaccine availability.
Certainly the University of Montana early on was positioned well to receive the vaccine. We've been receiving Pfizer, which I think most folks know has a pretty strict storage capacity or storage requirement. I think it's minus 80 or 90 degrees. And so having special coolers to be, or freezers to be able to receive it. Our health sciences pharmacy here on campus can receive, can also distribute and administer doses as well. So we think the university is in a great position to help local partners as well as to provide vaccine in the community. Over the last 2 Sundays, we've been able to be a host site for a mass vaccination clinic that is run by the Western Montana All Hazard Mitigation Team, so the county team that's handling logistics and coordination. We were able to do, I believe it was a little over 400 doses 2 weeks ago. We doubled that. There's conversations about scaling that operation even further. But I think, again, as Joyce mentioned, some of that relies upon predictable and consistent supply of the vaccine. And so I think the team's done a great job of trying to get the vaccine out as soon as it's available and to have these events, which I think are very well run in the Adams Center. But we know that the demand is extremely high. We know that those slots fill quickly. We did have slots available through the call center for people that didn't want to try to do that through the internet, and they could call in, but still demand far exceeded supply. And I think the solution for all of us is to get as much vaccine out there and available for distribution as possible. So certainly understand people's frustration who are online trying to get an appointment or on the phone trying to get a vaccine appointment. And it's been difficult because demand has far exceeded what we're able to do. But we continue to talk about scaling that operation. And you know, I think even broadly outside of Missoula, I think that our School of Pharmacy and our College of Health here on campus, you know, for many, many years, of course, have been putting graduates out into the community. Many of our rural pharmacists are come through the program here at UM. So it's been really exciting to think about how pharmacists from the University of Montana are figuring large in delivering this vaccine. So that's been great, but certainly happy to help, happy to make our facilities here on campus available to the community, and we'll do so as long as that's a need out there. So as long as people need vaccines and this is a good place to get them, we will make that space available.
And Grant, you already talked about fear of COVID being responsible for a lot of the economic hit here early on. And I'm wondering from the economic side, how quickly do you see vaccinations turning things around when it comes to consumer confidence and any other aspects?
Well, I think if we look at the trends that we saw earlier this year, I think vaccines are obviously going to be a tremendous help. And I'm encouraged in conversations that I've been a part of with the emergency response group who are standing that vaccination program up. All indications are that as a community, we have developed multiple times more capacity to deliver vaccines than we're getting right now. So my understanding is we're getting around 1,500 vaccines a week at this stage. And we have the capacity to handle much, much more than that. So maybe one sort of silver lining here is that this slower deployment early on has allowed us to get our systems in place so that when those vaccines become more available, we're ready to deliver. But I do think that we're all, you know, this benchmark that our local health department has set, which seems to be based on evidence coming, I think, out of Harvard Medical School. It basically says that if we can develop a trend where we have 25 or fewer cases per 100,000 people for a 2-week period, then they feel like that's a signal that we have a low enough occurrence of community spread in Missoula that we can lift some of the restrictions we've already seen. And I think what we have seen as a pattern is that when we get to those lower levels of spread in our community, we do start to see more confidence in people coming out and doing business. The other thing I would add is that we've seen some pretty innovative and I think really well-established partnerships between our health department and local businesses. And so there's a really strong plan in place about how our businesses can deploy best practices that have been vetted by our health department so that when that time comes, we'll be in a position to create either greater hours or greater access to some of our community businesses. And I think those things will help. And the last thing I'll say is between now and sort of a widespread vaccine where we hit, what I'm hearing is that 75 to 85% is that it'll be summer again. And a big part of what's allowed us to do business in Montana has people outside conducting some of their business. And to be able to do that again, I think will also be a big help for what we're trying to accomplish.
All right, thank you. And I want to start with Paula on this next item, which is discussing the implications of COVID-19 on the education system. I mean, overnight, back in March, educators had to turn on a dime to enable remote learning, and every step of the way since has proved to be challenging for parents and students and teachers at all age levels. So Paula, tell us about the university's perspective on that.
Well, I think first thing I have to say a huge kudos and hats off to our faculty members here at the University of Montana for the quick pivot in March. And I mean, that is one of those, that analogy about building the plane while flying it. I mean, we had a wonderful team over in our Online that conducted classes for faculty members on, who may not be familiar with Zoom and how to transition. At the same time, back in March, when we were, quickly, moving students to online, I think that the president here smartly kind of put us on a path of thinking about this pandemic on 3 planning horizons. So of course, last spring, it was about, how do we safely pivot to online classes? How do we allow students to keep on learning through the pandemic? And then there was sort of this mid-range planning, which was, how do we mitigate risk at the university? At that time, there was no vaccine in sight. So how do we set ourselves up to be able to work in the COVID environment in the coming year? And then third, really that question about what does the university look like on the other side of COVID-19? And I think there will be some things that come out that we'll be able to use for years to come. For example, I think many of us are sort of unexpectedly becoming better and better at Zoom and some of those modalities. But the downside of that, of course, is, students do miss the engagement. They miss the face-to-face instruction. I know our faculty members do as well. But I think they've done a great job of incorporating technology. I think another really great example, last fall when the weather was good, we took the classes outside. We had tents put up all over campus. I think we had 10 outdoor classrooms complete with desks and, blackboards and, what we needed to have a class outside. But it's not as simple as sort of hitting a Zoom button. I mean, we've got students that need to attend classes asynchronously. So our faculty members were in our one button studio in the library recording their lectures, and they were doing Zooms at different times and really trying to meet students where they were to allow them to keep on learning through the pandemic. And I'm sure that those examples are in K-12 as well, but I think that's probably, I'm most proud of the ability that really hundreds of students, in fact, thousands of students since this pandemic began at University of Montana have been able to continue and to complete their degrees. And I think that's probably the proudest accomplishment that we have at this point in time, was we were it allowed students to enable their pursuing their educational dreams. So that's been a good thing.
And Joyce and Grant, I'll let you decide who goes first, but aside from higher ed, working parents suddenly had to figure out how to find childcare and homeschool teachers in order to go to work. I know it certainly affected folks in the medical community and really everybody.
Yeah, maybe I'll share a few numbers that we're aware of, and that is that, and these are numbers for Montana. We don't have this data for the county level, but in Montana, 1 in 5 workers lives in a home where both parents work and they have a child under the age of 13. So that's, it's actually 22% of our workforce for whom that's true. So 22% of our workforce essentially now is needing, in order to do their job, having to balance taking care of a child at home for some portion of the day or week while juggling their jobs. And the numbers based on initial surveys is that folks who were trying to balance that dual role were spending between 6 and 8 hours a day trying to juggle that care role. So, you could see pretty quickly the impact that has on overall productivity in our economy, But I think the place where it really shows up is that challenge that people had getting their workforce back. Because while we had parents taking care of kids, we had so few daycare providers available to us as a community. And so for many families, there was nowhere to send a kid, and they didn't have a job that allowed them to juggle, like I have the luxury of doing my job online while juggling that role. Some people don't have that luxury. So they were really forced out of the workplace because our childcare providers, frankly, had to reduce their capacities in order to meet the strict standards and or raise prices so that they could continue to operate and function as a business. So we really, getting back to even that first question of strengths and weaknesses as a community, we were already a community that was woefully under supported in terms of childcare. And this just kind of put that on steroids. And it really, I think, limited the number of people who were able to do their jobs, go back to work in cases where they had an opportunity with an employer. And there's no question that the statistics show that this burden fell disproportionately on female workforce. So is a real, I think, a blow to women in the workplace and overall productivity as a community. I guess the only silver lining I'll say is there was also an incredible amount of collaboration that came together to deliver some pretty innovative sort of school hour childcare services for kids that would otherwise be going to school. And just hats off to the groups who came together to make that possible where it was possible.
And Ritz, I would just only add, we're a large employer, so we certainly felt some of the constraints for our own employees who were doing the juggle, to use Grant's words. We've been effective, I think, in helping. I mean, we have an opportunity to do different schedules in a 24/7 business. And so we have some flexibility there, but we needed our workforce to be in taking care of patients. So the remote opportunities were not great. However, about 10% of our workforce did find that they could work at home remotely and didn't have the daycare challenges that others had. And that really leads me to the technology sort of side of things, which is what we saw in healthcare was a move from in-person physician visits to technology visits. We were doing less than 10%. Now we actually went up to about 80%. We're back down into the 40% as we're trying to figure out what's the right place to go. But again, the technology, which it feels like it's such a theme through here, is that we learned how we could do things differently. And in this case, it's that you can see your physician and have a good visit using like a Zoom platform or a platform. So I won't take us down that rabbit hole, but that certainly was something that came out of this challenge of I would say the workplace challenge.
I am going to take us down that rabbit hole because we're going to talk now in that vein of old and new technologies and how they really played a massive role in our ability to adapt. And so I'm wondering, in all your fields, what were the successes and efficiencies and also the downfalls, and how does that play out moving forward? Do we see this kind of continuing beyond COVID?
Well, I'll just finish up my answer in saying what we did learn, again, was that we could provide care virtually in many settings more than we ever thought. And I think the challenge into the future is how much of that will consumers expect or demand, or how much will consumers say, no, I really want to go back to the in-person. So we don't know what the right balance is going to be in healthcare, particularly in the outpatient setting. But we're really trying to work with our patients and again with our physicians to understand what's the best from a value standpoint and really the best from an experience standpoint.
I think similarly for the University of Montana, I think, one thing that you do build some efficiencies when you're working on Zoom. There can be some efficiencies, but you give up some things as well. And one of the things that we heard loud and clear from our students that didn't have as many classes online and didn't have the opportunity for face-to-face engagement was they really missed that. And I think that there's, Zoom is sort of it's a poor substitute for some of that face-to-face interaction in real time. I mean, this semester, I think it's been well covered. We have an ice skating rink out on the Oval. I think for the first time ever, an actual sanctioned ice skating rink, and it is full all the time with people wanting to be outside with each other, talking. Students with faculty members, whenever they have a small enough group and the weather permits, they're trying to go outside so they can be together and they can talk. And there's just some things I think that are lost there. At the same time, for people that for whom distance education is really important, I think you'll see the University of Montana continue to enhance its online deliveries, online degree programs, and continue, which has been a trend nationwide in higher ed. And I think this has been another forcing function. I mean, we were well on our way to thinking through some of that, and we, already certainly had offerings online, but I expect to see that expanding because people are seeing that they can, get certificates and do some of that degree completion without having to, while at the same time having a job or raising a family or something that might preclude them from coming to in-person synchronous classes.
I guess before I dive into innovations, I want to make one appeal to the community that's watching about the last subject, and that's sort of childcare and child development. And that is that I think we're all desperately in a rush to kind of get back to business as usual. But I think we would be remiss as a community if we don't realize that our children have been through sort of, by the time we're back to normal, a year to 18 months of extreme disruption in their learning environment. And I think I hope that we as a community are making a concerted effort to figure out how we correct for that over the next decade to put people on the right path and get children back up to speed. And frankly, I think it's an opportunity for us as a community to get a competitive advantage over other communities if we can be truly innovative around how we think about the future of our next generation of workforce as a result of COVID. But getting back to the innovations question, I think we saw this, frankly, this was the most inspiring part of being a part of COVID response. We saw innovations happening at every scale and almost in every sector in response to this. And some of them were really some of the most inspiring experiences that I've had professionally. And I think we can be really proud as a community. I think about the sort of earliest and some of the darkest days of COVID for me were just those first few weeks where there were really questions about whether or not we were going to have the adequate supplies to even keep testing people for COVID in our community. We were able to identify some of the biotech companies here in our own community to develop some of the important viral test media that allowed our hospitals to continue conducting those tests in a timely manner to keep on top of what our spread was in the community. We saw a local manufacturer in Coaster Cycles that pivoted almost instantly from building bicycles to building face masks, and we're selling those face masks to the state of New York and across the country. And even later into the process, we saw a startup here at UM in Montech, Fire Diagnostics, that had been a sort of testing biotech company in the beginning and eventually went through something called an emergency use authorization to develop a testing product for COVID here in Missoula. And I share that as an example, both because it's a cool company story, but also it's an innovation of our federal government, which is not known universally for being innovative. But I want to acknowledge that those emergency use authorizations and the ability for our government to say we need to act fast here, but still act prudently was pretty remarkable in a lot of cases and allowed a lot of important advances to happen relatively quickly. I also think, just to share a couple of examples, we saw collaboration happen in innovative ways that I've never seen happen before in this community. And I think we saw that in our local governments and service organizations and the university. We had community leaders from the University of Montana, the city, the county, the health department, and our hospitals meeting weekly and daily in the early days to figure out what they were learning and what they needed and what we could deliver for solutions. That was incredible. And many of those meetings are still taking place to sort of make sure that the balance of our community is being managed. So I think overall, I think those are the things that are going to stick and really make a big difference on the future. And I think those kinds of innovations across the board are just sort of should be points of pride for all of us in the community, because I think they really reflect on how committed everybody was to bringing whatever skills and strengths they had to the table to get through this. And then the last thing I want to share, is just like this notion of innovation, I think can be a little dangerous on businesses, because I do think that many businesses who have struggled, I hear folks in the community saying, well, why don't they just innovate and pivot so that they can get through COVID? And the truth is many of those are great businesses that functioned well before COVID, and they will function well after COVID. And what they need is just that ability to pause and catch their breath and get through this so that they're a great business on the other side. And we don't need to ask them to change everything that they do in order to be a good, productive business in our community going forward.
And much to my son's chagrin here, snow days going forward, he's realizing those are probably not going to happen now that he can learn remotely. But I'm wondering, Grant, I'm going to put you on the spot on that because, anecdotally, we heard of a lot of people moving to Montana because they could now work remotely and they wanted to be here and they could do their jobs. Do you see that playing out and sticking that way where some of these larger companies are allowing folks to live wherever they want and work actually here from Montana?
Yeah, I think this is a great debate in business today, is how much of this will stick around. But there's no question that many of our workforce in Missoula were working for companies across the country already. I think the big change was that more companies allowed their employees to do that. And frankly, because we had done such a good job of containing the virus in our community and we were seen as a low population, high quality of life location, we were on the map. This Zoom town craze that got built up. And that frankly exacerbated our already challenging housing market and really, I think, probably gave us what was a 10-year horizon to address housing, got squished into probably a 2-year horizon for us to address housing. But I think that trend will continue enough to have an impact on Missoula. Whether or not it changes industry across the country, I don't know, but we're a small enough community that it doesn't take a lot of people looking for the best place to live in the world to realize that this is it. And they'd like to be here to be a part of this community while they keep a job from a higher employer from the coast. What I am hearing is a trend is that a lot of companies are saying you can live and work wherever you want, but we're going to adjust your salary for the cost of living in that place. And so it probably won't be quite the same in the future where somebody gets the same salary as their peer working in, say, San Francisco while they live in Missoula. There's probably going to be a greater trend towards adjusting for where the person lives.
So continuing kind of on what Grant was talking about for Paula and Joyce, how have you seen the Missoula community build resiliency and solidarity through this pandemic? And what are some of the examples of collaboration you've seen?
Joyce, go ahead.
Well, I think we've talked about the collaboration. I think the resiliency question is really a big focus, particularly in healthcare right now, where we're seeing our healthcare workers who have really been challenged for a year in an ambiguous and ever-changing situation. So the challenge is to be able to offer support to those staff in any way that we can make happen that's of meaning. And for everyone, there's a different meaning in terms of what it takes for them to be resilient. Most people living in Missoula want time off. And so we've really been able to move people's schedules around and allow them the time off that they'd like to have within reason. When we get very busy, of course, we need sort of all hands on deck and we lose that opportunity. We have a lot of online resources, from meditation classes to yoga classes to an enhanced employee assistance program through our healthcare benefits. And we're really trying to create space in the Zoom world to have meaningful conversations. And as both Grant and Paula talked about, that's very difficult because I think 1 year later, individuals really want to see and be with each other. So I love the ice skating oval. Like I've said to some of my staff, why don't you go to the university and see if you can go ice skate? Because it just is, it's a wonderful sort of endorsed, safe outdoor environment. We really are trying to help our employees take advantage of that rather than sort of think that there's nothing that they can do for their own resiliency. And so we're wide open to other collaboratives, other conversations with anyone around how we can build this resiliency in our community. I would say that I think Missoula is resilient, but we have hit sort of a fatigue factor right now between the ongoing COVID cases, which are lower, and yet at the same time, this sort of vaccine shortage challenge we're facing in healthcare, and would really welcome opportunities to think about how we can build resiliency across disciplines, if you will, across professions. So we'll look to the university a lot for that because we know that they have innovative young people that can maybe help us beyond the ice skating rink, Paula.
Sure. Happy to do so. And I think a couple of collaborations that stand out for me through this pandemic have been the collaboration with our School of Public Health and Community Health Sciences and City County Health Department. We have an academic health department. That model is not super common, but certainly beneficial in terms of being able to access the faculty members here on campus who provided information on epidemiological data and modeling, not just for Missoula County, but statewide, and being able to share information in that way and really make sure that everybody's kind of on the same page and understanding how coronavirus is impacting our community and what's currently happening. I think the second is the university did collaborate with Missoula City Parks and Recreation on some childcare opportunities and options before students were back fully or starting to go back to face-to-face. And I think just the creativity of asking and knowing we too at the university have a lot of our employees who have children in K-12, and therefore if they can't care for their children during the day or make arrangements to do that, it's going to be hard for them to come to work at the university. And so I think just what I love about Missoula is I think that we do sort of come to the table and really all options are on the table until they're not, right? So we're willing to really mull over possibilities that might even seem like really crazy ideas that actually out of that come some really interesting sort of new innovations that I think that we'll be able to draw upon later. I'm always telling people, there was not really a playbook for a global pandemic because we've not experienced it in our lifetimes. And so while we had some really good, I think, frameworks to go from, it's that the things that we've kind of hung on that framework, the detail that we've been able to flesh out with partnerships and innovation has been, I think that I hope is one of the positive legacies of going through this together is that I do think, I agree with Joyce and Grant that I think Missoula is resilient and resilient because of the relationships that we have that enable us to be able to respond to something like this that's really never before been experienced in our lifetimes.
Joyce hit one of the buzzwords, which is fatigue and uncertainty, two words commonly associated with the last year, and also a sense of mistrust in certain systems and institutions. And I'm wondering where the three of you have noticed that most in your orbit.
So maybe I'll start. I think, we talked a lot about inequities throughout this, but I think it's important to realize this past year was not just the year of COVID, but it was a year where our nation and our community was challenged by social unrest, political unrest. I think it is true that everybody is fatigued by all of the anxiety and stress that we've all been through the past year. But I think it's also been a time at which one can develop some compassion for the fatigue that many people who feel like they've been sort of left out of the progress of our society have felt for a very long time. And I think, a good example for me was 2 weeks after we were in lockdown, I realized I'm afraid to go out of my house right now because I don't know what's out there. And I don't know every single person I see, I don't know if they're a threat to me or if I'm a threat to them. And that was a really powerful moment for me to realize what some minority populations in our communities in our country have felt for a very long time of not knowing who their allies were and who their friends were and who was a threat and who was not. So I think for me, the big lesson about resiliency, and I think what I see transcending all of this is that if we're not mindful of those inequities, if we're not thinking about how we continue to innovate to address those coming out of COVID, I think that we will continue to see challenges in those areas in ways that we've maybe only begun to.
Yeah, I'll just, one small comment. I do think being mindful of the inequities is key. Grant, what you said, it's paying attention to what that might mean to an individual in a situation like we've never before thought through. So for us, a current example right this moment is if we are allocated vaccines this week, how do we make sure that we are giving vaccines to individuals who might not be just over 70, but in fact have health disparities that have been identified? And how do we reach out and get an appropriate amount in the queue? And I don't know that we would have been so quick to think along those lines a year ago. I think we would have been a bit more black and white and a bit more numbers oriented. And so I really think it has given us that pause and that opportunity to be more, I would use the word qualitative in our delivery just as much as we are quantitative.
What I would add, I think that the fatigue piece of it is, I think, compounded by the fact that in a lot of ways we can see the the end, if you will. I mean, we can see the other side of the pandemic, but there's still a lot of distance between here and there. So it's different from, I think, a year ago when we didn't really know no one had a line of sight on a vaccine. No one really fully understood what COVID was going to, how that was going to sort of play out in our communities across the country. Now we have this hope with a vaccine, but there's still, it's a long ways to go. We don't have enough vaccine currently. The rollout is going to take some time, even under the best circumstances. And I think that contributes to this, the fatigue and sort of just the anxiety too, because I think the other piece of this is we all know the vaccine is not sort of the end of COVID-19. And so I think there's still some uncertainty about what does this look like even after we have whether it's herd immunity or after we have vaccine widely administered. What does it look like on the other side? Certainly a question for medical professionals and not me, but those are the things that people are thinking about. Is it's going to be a new normal, right? It won't be where we were in January of 2020. It will be something else. And what does that look like?
All right, everyone. Thank you, panelists. Thanks, Maritza. It's now time for what would be in a former life for table talk, but instead we will open up the forum to questions from the audience via the Q&A system. If you're not familiar with Zoom, there's a little button on the bottom right corner of your window with Q&A. Please type your questions into that. We're looking for questions, not statements. And again, as I said at the beginning, we're committed to civil discourse. So we ask that you keep your questions civil and avoid making statements. A couple of our board members behind the scenes will forward your questions to our moderator, who will then ask our panelists. Thanks so much.
Okay, our first question comes from Gail, and she wants to know, as food bank workers, we were considered essential during the shutdown, but haven't been specifically included for the vaccine. Has frontline essential worker for phase 1C been defined yet?
So I'll take that question and say, I could not tell you what the 1C criteria look like. Those are very specific, and I always reference back to the state website. They have those listed. And so at the moment, we are just focusing on 1B. So I'm sorry to say I don't have specific information, but I do know it's out there on the state website.
Okay, I'm just waiting. Here we go. Somebody wrote us, was frustrated trying to get my 81-year-old mother-in-law signed up for the vaccine and was ready with her birth date and insurance, but was asked for her email and address, which I didn't have at the top of my brain, so it slowed me down and I wasn't fast enough. Could there be one or two standard questions to ask instead of a different question for different locations?
Again, I'll take a stab at it, then I'll throw it to Paula relative to the university mass vaccination. What we're trying to do in the community is create a standard, but we know today that there are different approaches to that, obviously, as you've described. So I like your suggestion, and I would just say we can take it to the Emergency Operations Center to ask as we plan into the future, can there be 1, 2, what are those standard questions that we can put out there? And I apologize. I know it's really frustrating to try to get online and then have the slot or the time go and not be able to make it happen. I apologize for that. It's a difficult situation we find ourselves in.
Yeah, I would say similarly, our team is actually having another sort of after action review on the signups from this last session and how that went. I think we made, one important adjustment from 2 weeks ago, which was to be able to have some slots that were available for reservation over the phone. So folks that weren't able to access the online sign up could do that in person. We're looking at other ways that we can improve that. In terms of the information that we're currently asking, a lot of that is driven by being able to communicate for the second dose of this 2-dose series. I have a lot of people that ask, why isn't this like a flu shot? Why is this so much more difficult? And there are lots of reasons why it is. And just in my, again, not a medical person, but just the fact that it's a 2-dose series that requires a very specific amount of time, a window between, the fact that when you come to get your vaccine, I mean, the clinic itself has to be mitigated for risk with masking and distancing and traffic flow and congestion, and and then the 15-minute evaluation period to make sure that you don't have an immediate reaction. So it does look different than a flu clinic would, but I think the team's been doing a good job, and I think the folks that have been putting on vaccine clinics have been really trying to design for that and make it as easy as possible. But that is also feedback that I'll share with the team just to understand who's asking for what types of information, because if we could standardize that, it would be easier for people who are trying to get on those limited slots online.
And I'll jump in and say I pulled up the 1C population. Frontline essential workers are listed on there, but as you know, things are defined differently. So we'll see when we get there about 1C. But my next question is from Bert Lindler. How would someone who is not yet 70 but has autoimmune issues be considered for inclusion in 1B?
Having trouble coming off mute, most specifically because you raise what we call a really complicated question to the vaccine. So there is a list of chronic conditions. One may be yours. I don't have those again in front of me. And so that would be a time to have a conversation with your primary care provider to get an understanding of if that person really does believe and agree, and probably does, that you're in a high risk category. And then it's a matter of trying to get you into the queue, whether it's at the university or with your primary care provider. And that's the hard part. So it doesn't sort of change the equation. It's very similar to the person who's 70 and who has no chronic conditions and is clearly in the 1B category, but clearly has to try to get an access to a vaccine. And so I will say this again, I apologize sort of globally that we really do not have the numbers of vaccine that we need to meet the demand. And we're being as transparent and as not as transparent as we can be. We are being transparent, and we're really trying to open it up as much as we have vaccine supplies, but we just don't have enough. And I'm not trying to place blame. It just is a fact of the system. We're set up. We're willing to give it. We're willing to give it to every single person in 1B and move to 1C as fast as we possibly can. We just don't have the vaccine.
All right, this is from Clint. What is a realistic timeline for when it will be safe for large gathering events to begin happening again?
So I am not the county health officer, and I am not a I'm not going to predict, or I don't have a crystal ball. If anyone asks me, this is my own personal opinion. So you cannot go back and look and see where I found this. I really think it's going to take us to the end of the year before we're going to be comfortable. And I don't know if Dr. Fauci has said that, but as we look to the number of vaccines and really what we're going to, and the variants, which has created another unknown in our society, I think it's going to take us until the end of the year and may beyond. And a lot of that depends on, again, the vaccine distribution and our ability to hang in there and continue to mask, which I think is really a challenge. I think that brings us back to the fatigue question. So I'm sorry, people call me a little bit of a Debbie Downer because I tend to be pessimistic, but I just think we don't want to set our expectations too soon because the unknowns continue.
All right, Ed from Montana Public Radio wants to know for Joyce. Sorry, Joyce, you're in the hot seat right now. Lawmakers have sent a COVID liability protection bill to the governor's desk with current cases and level of vaccine prevalence. From your perspective, is Missoula ready to relax the mask mandate?
So I'm going to repeat, I am not the public health officer and I really have no authority. Grant did talk about the 25 per 100,000 incident rate that we've been trying to get to, and we're either close or have hit it occasionally. But from my conservative standpoint, I do not think we're ready. And I don't think we're ready, not because our data is good. I just don't think we're ready because there's too many unknowns that continue to come at us, which is the instability in our vaccine supply, as well as the new variants. So my appeal has been for now a year to continue to mask, to continue to be really conservative. And I've had those conversations as I sit on Grant's board in terms of what does that mean economically? Can we be safe doing the things we used to do a year ago? We're not going to get back there, but I think as long as we're following appropriate social distance and trying to keep our small businesses going by shopping appropriately and safely and as outside as much as we can. But again, what you're hearing is my opinion after having lived through it for a year with absolutely no authority and probably not really enough clinical ability as well.
I'll jump in there too, Ed, and say that Dr. Walensky, the CDC director, addressed this kind of on the White House COVID-19 task force call this morning and said that with the variants and, high hospitalization numbers elsewhere, that she didn't think now is the time to be relaxing any of those directives. The next question is from—
really quickly, Maritza.
Oh,
I asked the question, but I just want to stress that 25 cases per 100,000 is not a threshold at which to stop the mask ordinance. It's really a threshold at which to continue increasing some levels of activity, hours, occupancy levels, and some kinds of gatherings. And so I, as someone who wants our businesses to succeed and whose job it is to help our businesses succeed, I hope and I sort of trust that we're going to continue to see masks encouraged and part of the culture in Missoula, because that's the safe way to get out in the community and conduct business. So that's what we're expecting to see.
Okay, the next question comes from Melinda Hickey. My husband is a 7-year-old veteran. Does the VA have doses? I know they vaccinated veterans over 75.
Happy to weigh in again. We were informed that the VA does have a separate allocation of vaccines. How many and how they're distributing, I honestly don't know, and I'm sorry. I hope that the VA can be the source of information.
And I actually have some information on this from a call I had before this. I know that there is going to be another VA clinic announced for Missoula, hopefully by the end of today. They were just trying to lock down doses and a location. So listen in, Melinda, because I think we will have some answers for you there by the end of the day. From Nancy, how should we respond to people who don't believe in the vaccine or don't think it is safe?
Well, there is so much information on credible, again, websites that I would say we have actually gone to our state website. We've gone to our CDC website. We've tried to give information around the efficacy and really the understanding of the risk benefit taking the vaccine versus not taking the vaccine. I do feel like it can get a challenge if you don't have the clinical background or if you don't have the data or the science. And I did hear Dr. Fauci today one more time indicate that the 2 doses for both Pfizer and Moderna should stay intact given the data. And I know we've thrown out data and science a lot, perhaps, but that really is the gold standard for how we would suggest that masking, that vaccines, and the data behind the vaccines make it safe. I don't know how else to convince people other than using data, because it has become such an emotional standpoint. The other thing that occurred to me professionally was, as we get more people who have successfully been vaccinated, perhaps we need to ask them to share their stories of how they have at least the process and their initial vaccination situation. I don't know if that will help, but it's just another angle of an individual being able to say, yes, I've been vaccinated. I feel really confident in my ability, and I'm still wearing my mask.
Okay, from Susie, why has the health department declined to allow a person to move from one assisted facility to another and only allows admittance from the hospital? Can there be any exceptions to this ruling?
You know, again, I think that's a health department officer policy, and so that they would be the ones that really need to answer that directly.
Okay, while we wait for some more attendee questions here. Oh, here we go. Here's one from Frank. Is it clear yet how the nearly 20,000 doses left over from the nursing homes announced last week will be distributed, and how many or when we might get them in Missoula?
That's a great question. I think this morning, actually, there has been some email traffic from the State Department of Public Health with how those will be allocated across the state. Again, I don't have access to that as I speak to you, but Governor Gianforte was very transparent last week and indicated that there would be a transparent process. But I don't even want to pretend that I know the answer, but I think the answer will be out there today.
Yeah, we'll keep watching for that too. That's been a common question about those extra doses. From Susie Orr, I had COVID in October, a very mild case. Do you know how long I am immune? I've heard 3 months and 6 months. Any idea what it is? I've heard this one a lot too, Joyce.
Yeah, I'm sorry that I'm the it isn't quite clear yet how long the antibodies are staying up in anyone who's had COVID. It depends on the severity of the illness. It depends on you as an individual. So there is no data out there that is hard and fast. And I'm sorry for that. Again, another one of the unknowns. I'm sorry that you had COVID, and I wish I had a better response.
Okay, I'll go back to one of my other questions while we wait for more questions here. I'm wondering what you guys think we've learned from this hopefully once in a lifetime experience to prepare us for the future. Should we see another global pandemic sooner than any of us would like?
Maybe what I'll start with, because I think it's indicative of our questions that we're hearing from the audience, that as human beings, we struggle mightily with uncertainty, and that we really do live in a world where we have developed so many technologies and have such cutting edge science that a lot of times we feel like everything should be certain. And I think one of the things that has been a powerful lesson for me coming out of this experience is that when we deal with something for the first time as a global community, it really creates that level of anxiety and uncertainty that frankly few of us are familiar with. And I think in terms of lessons learned, I think that's something that we can just be mindful of going forward, so that we can recognize that many people, including experts, are sort of heading into unknown waters for the first time, and providing a bit of grace around that uncertainty, even though it's very frustrating to not get answers for questions that you have, is a really helpful way for us to be resilient as a community and just take care of each other.
I would add that I think that one of the challenges, it's a good and a bad thing, is I think we have access to information at a pace and scale that we've never had before in history. And I think with that comes a lot of responsibilities. I mean, my sort of one ask with people, and I talk to people a lot, that, you know, I heard this or I read this somewhere, and that is really understanding the source of the information that you're getting. And you know, not here to say this source is more credible than that source, but you really, I think people really have to, especially if you go and you see something on the internet or on social media, click it, look in the window, see where it's really coming from, do some independent fact checking on that. You know, with all of these studies, it seems like you can actually independently fact check them on other sites as well. You have to be careful, because you can certainly get into sites that maybe aren't credible, but I think that's a big one, is that the good news is you have access on your phone to more information than you've ever had. The bad side of that is some of that information is not accurate. So being able to fact check that, and I know that opens up a whole, probably a longer discussion than we have time for today, but I do think to the extent that folks can be certain of the source of their information, the better informed they can be.
Yeah, I'll just put a bow around that. I think that was well stated, both Grant and Paula, both the concepts. I think the other thing that we have learned is we cannot communicate too much. And so we have just said we need to be repetitive. We need to continue to communicate. We need to be transparent. And even if we feel like we've said things 10 times, maybe the 11th time will be the time that someone really listens to us. And I know that's sort of a basic tenet of anything in terms of leadership, but in the midst of the uncertainty, in the midst of information coming from many sources, to be able to effectively and consistently and predictably communicate, even if we don't have all the facts, I think really helps people build back confidence and trust in maybe systems or in the community or in their employer, wherever they may be at. So communicate.
And I think going back to Grant's point, the uncertainty and really not knowing when this will end, not having an end in sight, and with the vaccine that brings certainly hope, but no set timeline, which is hard. AJ Hetzler wants to know, will COVID-19 be an annual global vaccine in perpetuity?
You know, that's a great question. And again, I'm not speaking from the Anthony Fauci expertise, so please know that. But the thought in the literature is that we will likely see COVID as ubiquitous across the clinical spectrum, that it may become less likely or less virulent, if you will. No one's willing to say that yet. I think there is a sense that we might have a flu vaccine. As you know, COVID is part of that flu structure. Will we have a flu vaccine and a COVID vaccine? Unclear, but I think what is the sense is that we will see it in our society probably forever, and how we will, and likely a vaccine against it probably forever, and what that will look like into the future is pretty unknown.
If we're given a little permission here to speculate wildly outside of our areas of expertise, I think to me this relates back to your first question, or the question you just asked. And I agree with Joyce. Everything I'm reading and everything I'm studying suggests this is something we are going to be asked to sort of vaccinate ourselves on an annual basis, and the variants and the strains might change from year to year. But in terms of future resiliency, one of the silver linings for me is that we've really built an incredible ecosystem to address not just this, but I think many different forms of sort of threats to our health. And I think because of these sort of institutions standing up some of their testing capacity and vaccine capacities, and also the information that's being exchanged and the level of communication, I could see us, if we get to a point where we need these really hyper targeted, what strain is in your community at what time and what vaccines do you need? I really think that Missoula is a place, in large part, we've built the systems, and we can integrate those systems in a way where we can manage that pretty effectively in the future and be more resilient as a result of some of our strengths and industries here as a community.
All right, this question comes from Sandy Shepard, who asks, how will researchers know if a fully vaccinated person can be contagious?
Well, all of these questions really depend on an epidemiologist or a Dr. Fauci to know the data and be able to answer them. I really can't even take a stab at that, even if I wanted to speculate. I do want to add, though, one piece that probably needs to be stated, I think, really for Montana and Missoula as well, as our Native American colleagues have actually done a really great job integrating with the state as well as within their own sovereign nation work to distribute vaccine. Again, they don't have enough either, but they also have recognized the role they want to play, and they've been a supportive and collaborative partner in working through not only their early testing and identification, but in the vaccine. And I just had forgotten to mention that today, and I think that's an important concept for all of us who live in Montana.
And Sandy, I'll add, I think that, I'm no expert either on this. I'm not an epidemiologist, but everything we're reading is that they're looking at that. And that's why they're continuing to advise people to wear your mask and keep social distancing, because they just don't know. It's still very possible that someone who's vaccinated or who's had COVID can spread COVID. Linda wants to know, what steps can large employers, government agencies, and individuals do to help strengthen our small business community as it navigates impacts from COVID?
So I think culturally continuing to reinforce a lot of the norms around best practices right now is something that our large employers can help. I think another place where I think our larger employers are helping support our smaller employers by implementing those best practices in our communities is that many of those smaller employers are running those sort of frontline or face-to-face businesses, which are the most strongly impacted. And so what we really need is that sort of continuity in behavior and practices. We've also seen some pretty extraordinary outreach and philanthropy. I know the United Way has done some incredible work, as has our downtown partnership, to ask some of our larger employers and bigger industries that have weathered this better to allocate some of their philanthropy to help small businesses in our communities. That's been a great direct line of support that's really made a big difference in some of those businesses. And of course, you know, there's a campaign here to put your money where your heart is. And so I think to the extent that everyone in our community, when you're shopping, can resist the urge to order from Amazon and try to seek out either online or by phone products you might want from a local vendor. I think that every dollar spent in our local community right now makes a huge difference. So those are a few advantages. The last thing I want to put a plug in is that we're hoping to start this spring on a comprehensive economic recovery plan and a sort of longer range economic plan for our community. So we'll be reaching out to many of our industry partners and both employees and workers, as well as employers, to talk about what a resilient economy looks like in the future. And so reaching out to us, let us know if you're interested in being involved in that process. Would be wonderful to hear from you.
Okay, Ed from Montana Public Radio says he appreciates all the previous mask answers. Again, realizing Joyce does not speak for the county, but from her perspective, how is testing going? Is enough happening to confidently know how much disease is in our community? And what are the biggest testing challenges?
Edward, I think really the testing remains with the county. From my, I would say my very myopic lens on testing for, let's just say at St. Pat's in Missoula, our testing capacity has gotten larger. We've had access to testing platforms through our system, and then we've really had testing supplies stabilized. So we are confident in our ability to test following the policies that we've set forth, which include if you're coming in for an elective procedure, we want to test you. Obviously, you want to know, and we want to know for the protection of our healthcare workers as well as for you. So that actually has stabilized, and that's a big piece of the confidence in our ability into the future. I think this is sort of me on the outside of that saying what is not yet clear to me is if there's enough testing capacity for the asymptomatic person who wants to travel to, I'll say Hawaii, that's demanding a test within 72 hours, something like that. So that the symptomatic clinical testing, I believe, is in good shape really across Western Montana, but it's the rapid test. It's that I think I was exposed and I want to get a test quickly that I think continues to be a challenge and probably not solved. I'm not sure that that's a bad thing, though. I think the resources and the focus for all of us have been towards the testing and the clinical situation for the symptomatic patients or individuals in our community, as well as on appropriate vaccine distribution. So I would call it sort of the asymptomatic, casual, worried well probably continues to not be where our worried well would want it to be. Hopefully that makes sense.
I would just add, you know, the notion of surveillance testing, there's no, to the best of my knowledge right now, we don't provide federal funding for surveillance testing. And that's a place where I think it would give our health departments and frontline healthcare providers a lot more information around the status of the virus in our communities. So that's a place where I think there's more room for improvement, not necessarily in terms of capacity, but the way that we offer those services to the community and we fund them so that we have that information. And then the last thing is that we have these these new variants showing up, but I think the last number I saw was the United States is 49th in the world of nations in our capacity to track those variants. So I think we've got room to go to equip our community with the tools to understand which variation of the virus is in our community as well.
Okay, how will Senate Bill 65 help small businesses? Grant, you want to take a stab at that?
Could you give me the name of the...
I think Senate Bill 65.
Sorry.
No, that's okay. I'm pretty sure that's the COVID. Is that the COVID liability bill? catching me on the fly here too. I'm always amazed at the.
I'll start with the assumption that that's the liability bill, and I'll confess I have not read this bill verbatim. I think that there's sort of two schools of thought here. One is obviously we want our small businesses to not just create the perception of safety, but the safest possible environment for their workers. And so I believe the spirit of this bill is to say that if an employer is following all the best practices and doing everything that we know is possible to do, given the fact that we still have all this uncertainty, that they would be protected from lawsuits because they've put in the best faith effort to keep themselves and their employees and their customers safe. That seems reasonable. I think that what I hope is in that bill is a balance that really does hold the employers accountable, because as we talked about earlier, there's a really thin line between the perception of safety and actual safety. So long as those practices are being implemented, that's a very fair protection for an employer. And I think that would give, hopefully, our employees and customers confident that their employer is really being held to the highest possible standard. And if we have that level of confidence, it really does help our economy get back into a rhythm where people know best practices are being implemented, and the employer has confidence to stay open so that they're not at risk. The employee has confidence they're in a safe workplace, and the customer has confidence that the absolute best practices, making something as safe as possible, is being done in that space.
And success. 65 is the COVID-19 liability bill.
For translating.
I'm wondering, just as we wait for any other questions, personally, I think we've all figured out how to manage this last year and navigate this last year and what works and what doesn't. Personally, from you three, what have been your strategies getting through this, not only as citizens of Missoula County, but also leaders?
Oh, well, I can start. I think at two levels. One, the leadership challenge has been tremendous. And I think as you talk to other leaders, there is sort of this collaboration that you build with others. As you say, I had no idea that pandemic might end up on my professional resume. And so I think you have to be, have a little bit of humor. I think you have to be willing to share vulnerabilities and say, I don't know. And you have to give people grace and meet them where they're at. I do believe we've learned in healthcare, and I've learned personally, there are individuals who, will not go out until they're fully vaccinated, and others who really want to take, in my opinion, far too many chances. And how do we help people sort of understand the milieu and understand their personal accountability to being part of a solution? And I know that sounds a little Pollyannish, but I think that's part of being, again, open and transparent about the challenges we're all facing. And at a very personal level, I honestly don't have school-age children. My children are grown, and I have a grandchild who's not in school. And my hat's off to you, Maritza, and anyone else who's trying to really be both a teacher and a professional at home. I really feel like those are you are the people that those of us who don't have those individuals at home need to support and figure out how to keep you sane and keep you happy and keep you resilient, because you're our future. And I really believe those are the individuals who are most challenged. And then lastly, our poor and vulnerable and the inequities really in all of our systems, and I'll speak to healthcare, really have come out in full force, and we're reading that all the time. And how do we learn from what we've learned in this pandemic to sort of discreate some of those inequities in a way moving forward? I don't have the answer to that one, and that to me is really the future of where we need to get to once we get beyond this immediate vaccination.
I think for me, it's just been humbling to see how many people have rolled up their sleeves and have really engaged in this problem that is a shared problem, right? A shared challenge for our entire community. And to see so many people, really trying to work together and trying to support one another. And I think it's been real eye-opening to understand how COVID affects people so differently, and how everybody is facing their own, in some ways, unique set of challenges that come with their, with their life circumstances, if they work at home, or if they, have small children, or they're living with aging parents, or any number of things. So it's been, I think, to repeat what Joyce said about, the importance of extending grace to people, because you're just not sure really the path that they're having to navigate. And in some ways, COVID-19 has been, there's unity and sort of commiserating about the challenges that we have this collective difficulty that is COVID-19. But I think on the other side of this, we will pick up some innovations and some tools that are going to prepare us for whatever comes next. Hopefully it's not another global pandemic. I think we should be good for another 100 years in my mind. But if we're not, I think we'll have some tools to help us the next time.
I think for me, I would also echo the term humbling. We have so many extraordinary leaders in our community, and it's been really humbling to be at the table sometimes watching them make important decisions and work together. Also, it's been the most rewarding work I've done in my role at MEP, just the acute nature of being able to help and make a difference on saving a business or helping a community recover from something at this scale is incredibly rewarding and powerful. At the same time, I think I think it was easy before COVID to deploy extreme focus around my work. And I think what COVID really taught me is that's like, we have to be thinking about all of the connections of our work to various parts of our community. And, my appreciation and understanding of housing and childcare and all of the sort of impacts that those things and challenges bring to holding our economy back from being what it can be have been really eye-opening for me. And I think for many people in our community to see the way that our community interacts around different stresses and strains. So I think that breaking down of silos and developing new partnerships has really been one really rewarding component of this. And then just realizing that sometimes when you're working really hard to do something fast, you do make mistakes. And we've made those mistakes too. And it's been really hard to keep a finger on the pulse of the community when you're isolated and mostly at a computer or away from people. And so having really clear understanding of what the needs are and making sure we get those rights has been harder than ever. And luckily the community's been patient with us and done a great job of reaching out to us to tell us what they need.
And as my eye doctor told me, we need to blink more because we're looking at more screens. So keep blinking. Gail wants to know, I think this is probably for Joyce, if you have an eligible pre-existing condition, what proof do you need to provide when getting the vaccine? I've heard this a lot. Is it like an honor system? What do you need to show when you show up for that vaccine?
It truly is an honor system. You can imagine how complicated it is to prove that you have that chronic condition over the next person standing in line with you. So we've really accepted that individuals will tell us. And at this moment, and I can't speak for the system, Paula, I know can, we are really using the age of 70 as the first place for screening. That obviously is pretty black and white. If you're turning 70 in May, it doesn't feel very good today, but you have to start somewhere. And because those classifications out of the CDC are age-based, that's what we're using as the criteria. And then we're using the honor system moving forward.
The university as well. I should say it's the county event, of course, that the university is hosting these clinics, but that sign up is based on a self-attestation of your phase. And currently, if you go in to sign up, you have the options of phase 1A, tier 1 of phase 1B, and then phase 1B, focused again on tier 1 currently, but it would be difficult, especially in a mass clinic environment, to have people sharing sort of medical information in that sort of setting. So we do rely on, you self-attest that you are eligible to receive the vaccine in any given phase.
Kind of piggybacking on that, do you need to show your ID when you go to these vaccination clinics? And does it have to say, I mean, we've had so many people move into Montana. Does it have to be a Montana ID? And then all the limitations there with people not being able to go get their new driver's licenses?
We are asking for ID and your insurance card if you have one, and bringing a photocopy of that, as well as when you, prior to receiving your vaccine, you fill out a health survey that has a lot of that pertinent information on it as well that you're providing. Yep.
All right, everyone. Thank you so much, Maritza, Grant, Joyce, and Paula. This has been truly informative. And I think just in listening to what you said, I think we can all be happy we are where we are. And I think based on who we are and how we treat our neighbors, it's proven that we are resilient. And I think we can be cautiously optimistic that we can continue to thrive even as we work our way through this. I also want to thank our sponsors, especially the University of Montana First Security Bank and Blackfoot Communications, and of course, our audience. Without you, this wouldn't even be worthwhile. So thank you all so much for taking part of your day out for us and to learn a little bit more about your community. Please plan on joining us next month, March 8th, via Zoom, of course, for a forum on the film industry in Missoula. A little bird had told me that we have a panelist who is the location manager for the show Yellowstone. Maybe you've seen it, or maybe you were stuck in traffic trying to avoid it recently. But at any rate, it promises to be a great presentation, and I look forward to seeing you all then. Thanks again.